course, you're back. You're still watching The Lounge right here. Special thanks to all the guys that have been giving me those insights. Of course, we are in the dying minutes of the show right here, and it's just been quite interesting. But before we go any further right now, before we think of winding up on Yala, we have been joined by Mr. Inambao, who's going to tell us more about his organization. Okay. Good morning, how are you?
How are you? Fine.
You're rushing into talking.
Yes.
I love that. So let's introduce yourself. Who's
Yes,
Mr. Inambao?
Mr. William Shewo Inambao is the director of Hope for Human Nature, which is a Zambian humanitarian NGO which helps the most vulnerable patients in the hospital, those who come from deep villages after they have been referred to the university in hospital without relative support, or we can say because of their chronic illnesses, so they need basic support for them to be supported.
Okay, so why all this organization? What made you come up with this organization?
Yeah, the reason that made us to come with this organization, it was we are looking at the basic need which was needed the most in the hospital. As you are aware that when somebody is suffering with chronic illnesses, they usually need a lot of basic need. They will need to buy certain types of soap, certain types of medicine that the doctors prescribe. So those people, they can't afford because they are completely vulnerable. That's why they are coming from deep villages whereby there are no hospital, only maybe few clinics. So that's why they have been referred to the general hospital where they can where they can be attended by doctors, where there are good medicine, good machines.
Okay, so why corporate social responsibility programs was established?
Yeah, corporate social responsibility is one of the most important that every organization needs to do by helping those people in need. Because if you help the people who are suffering in the hospital, it means those people, they will be healed and they will be independent. That's why you see there are a lot of organizations which are helping in terms of agriculture, so that those people, they can be independent. They can work on their own after they've been helped.
Okay, I think I'll combine the two questions, really, the humanitarian, the aid of the humanitarian, of course, and looking at the health aspect. Why should people aid so much into the health sector, where, of course, helping the vulnerable, as you put it earlier on?
Yeah, people need to concentrate in the healthcare because that's where the need is mostly needed, because it's humanity first. We can't concentrate on these other things. Some of these other things, they are not so important because they are not humanity. But for humanity, you are saving somebody's life. Once you save that person will be able to save his family. That person will be able to save other people. That's why we concentrate mainly on healthcare giving, where the need is needed the most.
Then in the economic aspect, really, how do you think health is sometimes hinder they affect the economy aspect?
Yeah, on the issues of the economy, it will really affect, because if people are not productive, then it will mean that the economy, it will go down, because very few people will be able to produce. For example, if it's a big company which deals with making mattresses or producing food, then the production, it will go low, so it will mean people will start suffering, especially these basic Zambians who cannot afford basic things.
So how do disease and infection affect economic growth?
Yeah, it affects because as I mentioned, that people won't be so productive. So once people are not so productive, for example, some diseases may cause disability, whereby somebody who is to run a business, he stops running a business because of his health. You'd find that even relatives or people around, they need to concentrate to help that person instead of them going for work, so that at least they can gain more money or more food, so that at least they can support their families.
Okay, as you have heard for yourself, he has put it earlier on, as we said earlier on, that time and with us. So I hope we're going to have him next week so that he can be able to elaborate more on the same organization. I think I love the fact that he's helping people. Mostly we help so much people in our community, but right now, since he's taking him to the hospital, I think I love that idea. So we'll be able to talk more about that next week, but of course on behalf of the entire crew that we have been together in the production of this whole program, we are saying till next week. Take care. We love you.
Take care. Don't drink and drive.
Then of course
Stay
you can drink
safe.
stuff.
I know you.